Good morning, everybody. I want to thank you all for being here this morning. I'm John Erzin. I'm the Deputy Chief of Staff in the Office of the County Executive. This morning, you'll hear from County Executive Alsobrooks, who will be giving an update about the county's continued response to the COVID-19 virus. The County Executive will be talking about several areas to include our most recent metrics around the virus. We'll also be talking about vaccinations and testing and our emergency rental assistance program and a few other issues. You'll also hear from our Deputy Chief Administrative Officer for Health and Human Services, Dr. George Askew, who will be talking more about the metrics and also be talking about boosters, third shots, and some guidance on Halloween coming up later at the end of this month. When they finish, we'll open it up for questions, but I would ask that if anyone has questions not related to COVID and the information discussed here today, if you could hold those until after, and we can do those then. We'd like to keep all the questions during the press conference related to the material. So with that, I'll turn things over to our County Executive.
Good morning, everyone, and thank you for being out this morning. We do have a number of items that we are covering this morning related to COVID-19, including new changes to the indoor mask mandate that we believe will be really important to be able to protect our children. We also have an update on our county employee vaccination policy. I know there have been a lot of questions about that, and so we're going to address that and answer some of those questions, and we're working to finalize much of that policy, and we also have new information on booster shots. We're getting a lot of questions there and their availability to residents. I'm joined this morning by Dr. George Askew. I want to thank him for all of his tremendous work. Everyone in our health department want to thank them as well, and you're going to hear from him, and he will give you some additional information. I also want to outline at a very high level how our county plans to use the $176.6 million in state and local recovery funds that we received under the Federal American Recovery Plan Act, and certainly want to thank the federal delegation that worked tirelessly to make sure that we had those dollars available to us. And finally, we're going to highlight the work of our successful emergency rental assistance program. There is grave concern regarding the ability of many of our residents to remain in their homes as a result of COVID-19, and so we have information we're going to share there. But first, I want to go to the COVID-19 update. And thanks to our vaccination and masking efforts, COVID-19 has really slowed in our community. I owe a huge thank you to Prince Georgians, who I have to say have done an absolutely beautiful job of adhering to all of the advice that the medical professionals and those scientists have been giving us, including going back to masking indoors very recently. Prince Georgians did so without reservation, and because of that, we are really seeing our numbers going down. We do, however, continue to see community transmission. Our cases began to rise in early July, and what we know now is that new cases appear to be leveling off and slowly declining. And again, that is attributable solely to Prince Georgians and their diligence and just adherence to all of the policies. And I do want to thank them so much for the beautiful job they did. Dr. Askew will discuss the data in more detail, but we are currently seeing a 3.3% positivity rate in our county, and we are also, for the first time, this has been the lowest that we've seen since July, this positivity rate. Our infection rate is at 0.93, which is in the medium risk range. And our average daily case rate is at 12 per 100,000 residents, which has declined from over 20 per 100,000, and that was just at the end of August. And so we are seeing some progress in the right direction. And what we know is the best way to really avoid health implications from COVID-19 remains just to be vaccinated. The more of us that receive the vaccination, the harder it is for COVID-19 to spread in our community. So there really does not, it remains that the best antidote that we know to this point is to be vaccinated. And we are urging everyone to make sure that you and your family members and loved ones are vaccinated. We're really pleased to report that nearly 82% of Prince Georgians residents, our residents who are 12 and over, have received at least one dose of the vaccine. To date, our residents have received over 1 million doses of the COVID-19 vaccine. And I want to take a moment again to thank the hundreds of thousands of Prince Georgians who have stepped up and made the decision to get vaccinated. They have done so to not only protect themselves, but we know that the most important aspect of it is that you also protect your family and your loved ones and fellow Prince Georgians. Many of you have also heard that the federal government, thankfully, is close to approving vaccines for young children. And we're waiting for federal guidance on vaccinations for 12 to 11-year-olds. And when they are approved to receive the vaccine, we'll be really ready to provide those vaccines to our children so that they can remain safe. But what we know is that with more residents getting the vaccine and the case numbers slowly declining, we're trending in the right direction, but what we want is to continue to see those numbers going down. And so, as you remember, of course, we've reinstituted our indoor public mask mandate to stop the spread of COVID-19. And today, I am announcing that we are also expanding the mask mandate to include children 2 to 5 years old. That means that when children between the ages of 2 to 5 years old are indoors and in restaurants, they will likewise need to wear their mask unless they are eating or drinking. And previously, that mask mandate, we know, only included children who were over the age of 5 years old in the county. As a parent, I understand it, I get it. I know it is not easy to mask younger children, but we are really doing this based on the data that we have and out of a grave concern for our children, many of whom are getting sick. And so right now, our public health officials are concerned that with the spike in COVID-19 cases that we saw in young children between the ages of birth to 17, that we are just going to have to do more to make sure that we are stopping the spread of this virus. And right now, we know that that many, again, of our kids are impacted, and so we believe that this is what is necessary at this point to make sure that we are protecting them as well. We have heard a lot about the Delta variant, and I wanted to let you know that the spread of the Delta variant in our community proves that, again, the vaccination is the only way to go. And so we've recently been asking county employees to submit information about their vaccination status, and we have done this as a way to finalize our employee policy, vaccination policy, and we're still working to collect information to help us get a better sense for how many of our county employees are currently vaccinated, but we have found that so far at least 64% of our employees are vaccinated, and our goal is to get the county government to the same point that we've gotten our general residents. I told you a moment ago that 82% of all of our Prince Georgians have at least had at least one dose, and it is our goal to bring our government employees in line with that data. We'll be looking at this data also to come up with various methods to ensure the safety of our employees and residents, and we believe that that will include, of course, periodic testing, and incentives also for vaccinated employees. One of our agencies has already started testing on a weekly basis for all employees who aren't vaccinated in that agency, and that is our Department of Corrections. We've started there because of the nature of that facility with the congregate living. We thought it was important to start with the Department of Corrections, and many of our employees interact with the general public, we know, on a daily basis, and so we are also working to make sure that we implement the best and safest way to stop the spread of the virus while making sure that we're also able to continue to deliver critical community services. And so we're going to be working on that. But as we finalize our policies, we will issue additional directives to ensure that every employee knows exactly what will be expected of them. And whether you work for the county government or not, every Prince Georgian should get vaccinated against COVID-19. And if you haven't already done so, you can find a COVID-19 vaccine clinic near you. You can go simply to mypgc.us/COVID vaccine. Again, mypgc.us/COVID vaccine. After we've received the green light from federal and state governments, we also recently began offering COVID-19 booster shots to residents who received the Pfizer vaccine, and we've done so at the Sports and Learning Center. And based on CDC guidance, we are giving out booster shots of the Pfizer vaccine to people who are 65 years and older, and those ages 18 to 64 with underlying medical conditions. Individuals who are 18 to 64 who work or reside in certain settings may also qualify for the booster shot. And so, for example, if you are between 18 and 64 and you work in healthcare, a school, a grocery store, a correctional facility, or a homeless shelter, you are eligible for the booster shot of Pfizer vaccine. The CDC recommends that these groups receive a booster shot at least 6 months after receiving their second dose of Pfizer. And individuals do not have to show proof of eligibility. This is really important. You do not have to show proof of eligibility to receive a booster shot. But please keep in mind the timing for when you're scheduled for that booster shot. If you are moderately or severely immunocompromised, you are especially vulnerable to COVID-19. And as a reminder, the CDC has approved a third dose of the Moderna or Pfizer vaccine also for those who have weakened immune systems. And for people with weakened immune systems, a third dose is recommended 28 days after that after that second dose. Federal health officials have not yet approved booster shots for the general public for either Moderna or the Johnson & Johnson vaccine, and so we're still waiting to hear when those will be authorized. And Dr. Askew will talk more in just a moment about boosters and third doses in his remarks, but please know that we will continue to provide information to you as we get those updates and get the additional guidance that will be necessary from the federal government. Now on to a few other updates related to COVID-19. Under the American Recovery Plan Act, signed into law by President Biden, our county will receive a substantial allocation of grant funding. To be exact, that would be $176.6 million in funds to aid our recovery from COVID-19. And our county will use these funds to continue to keep our residents healthy and working to recover and to move forward with a clearer and more secure financial future. And so we're allocating these funds in a balanced way, using those funds for pandemic-related expenditures, and that means spending that is directly COVID-19 related, including services to the public and expenses that have arisen as well as a direct result of the pandemic. We're also using those funds for our behavioral health facility, and this will cover indirect costs to county government. It also includes hazard pay, for example, for public and non-public facing essential employees. It covers overtime pay and money to facilitate teleworking that we have found, of course, has become necessary and continues throughout county government. In addition to those allocations, we are using federal funds to aid our economic recovery from COVID-19 while providing support to residents. And so this includes funds for affordable housing. We're using those funds for a single-family rehab grant program and infrastructure also to address residential flooding. Overall, we've allocated these funds in a way that we believe puts the county on the best possible footing going forward. We've covered the costs we've incurred during the height of the pandemic from personnel to testing and vaccinations. And looking forward, we're providing business assistance, funding our homeless shelter, additional food support, and funds also to relaunch our successful rapid reemployment grant program that will help jumpstart even more county businesses. These funds will go a long way. We believe in securing the financial future of our county and allowing us to make progress for our residents with new programs and initiatives. So in addition to these funds, I want to talk a bit about the rental assistance program. We have a substantial sum that we've received federal funds for rental assistance. And recent studies, and we've been tracking this, estimate that between 19,000 and 22,000 households in Prince George's County are at risk for eviction. Our emergency rental assistance program has done an excellent job. We're so proud of it throughout this pandemic in terms of keeping Prince Georgians and their families in their homes. And the Department of Housing and Community Development and our community partners really have been doing a beautiful job with our rental assistance program. They have done a lot of hard work in terms of intake and processing applications. And I want to thank also the Office of the Sheriff and Community Legal Services for their partnership, also in their coordination with DHCD. The U.S. Treasury Emergency Rental Assistance Program awarded Prince George's County $84 million to assist our residents. And so far, our county has assisted 4,134 households with $30.8 million in aid. This aid has helped with both rental and utility assistance. And our county government, you should know, we are very Prince George's County proud of this, leads the state in distributing emergency rental assistance funds. We are number one in the state in terms of allocating those funds. And overwhelmingly, this assistance has reached our least financially secure residents. Now more than ever, the pressure to keep families in their homes is high. And so we are working, you should know, as expeditiously as possible to process more applications for emergency rental assistance. But despite the fact that we are a leader in the country in terms of the amount of assistance that we have gotten out to our families, we know that there is still so much work to do. And so we know that landlords are frustrated. We're hearing that the tenants are very frustrated and panicked. And that these entities are sometimes at odds with each other. And so we are encouraging you, however, just to work together. In this way, we believe that all of us will win and families avoid homelessness, and with expanded access to emergency rental assistance, landlords also avoid losing thousands of dollars that by finding new tenants and trying to collect back rent. And so we have plenty more money to spend and plenty of applications to process over these next few months, and we're accepting new applications every single day. And the program provides, we believe, a really compelling financial incentive to keep families in their homes. 18 months of past due rent payments are available from the beginning of April 2020. In fact, the Treasury recently released additional guidelines that we implemented aimed at getting assistance to families more quickly. And to make sure that we're reaching everyone possible, our Office of Community Relations is on the move. They are coordinating with our housing department, and we have put forth a comprehensive outreach program across the county. We recently launched a rental assistance hotline. We believe that this hotline will be helpful where residents can go. They get information about the program. They can find out their application status also if they have already applied, or schedule an appointment with a staff member if they need assistance with completing the application. The hotline is open, is 9 to 5 each day, Monday through Friday, and can be reached at 301-883-6504. Again, that's 301-883-6504, and you press 9 to get through. In addition, you should know that we're hosting a number of rental assistance community fairs. We're excited about these, where residents can actually attend, get more information, or to receive on-site assistance in actually filling out those applications. So we're taking a mobile kind of approach to this, just going out and about in the community, and we'll be in various places across the community to be able to assist residents in actually applying for those funds. We held the first community fair last month in Suitland. We had over 400 residents attend to receive help with applying for rental assistance. And just yesterday, we also held a very successful virtual information session for our rental assistance program in partnership with the Collective Empowerment Group. So we want to thank them and thank the faith community who have stepped forward, have been, of course, throughout all of the pandemic, have been just amazing partners for us, and they continue to do so. And so we want to thank them. Our next in-person community fair is this Saturday, October 9th, from 10 a.m. until 2 p.m., and that will be held at Langley Park, in Langley Park at the Langley Park Community Center. And if you have questions about rental assistance or need help with applying, please stop by there. So we're committed to ensuring that every resident who needs this assistance will have it, have access to it, and that they can submit an application. So to learn more about rental assistance, emergency rental assistance, view a list of documents needed to apply and submit, then you just go to hcd.mypgc.us. That's hcd.mypgc.us, and click Emergency Rental Assistance Program, and you can get all the information that you need there. So again, I want to thank Prince Georgians for just the tremendous job you've done in working together and caring for each other, especially over these last 18 months. This has been a challenging time for all of us, but we've been able to count on you, and so we just appreciate it and thank you so much. At this point, I'm going to hand over to Dr. Askew, the podium, who will give an update, and then we can answer questions. Thank you so much.
Good morning, everyone, and thank you, as always, Madam County Executive, for your steadfast leadership. And as I like to do, because I don't see it happening all across the country, is thank you for believing in the science and believing and taking the advice of public health officials. It really has made a difference, and you've saved many, many lives, many, many lives. Thank you to Prince Georgians. Prince Georgians, you've done a wonderful job, as the county executive has said, of standing up for each other, getting vaccinated, wearing masks, and doing those things that we hope to see happening to mitigate the spread of COVID. You've showed you're resilient by trusting the science, listening to the facts, and making smart choices for your health and for the health of others. The Delta variant threw us a curveball, but it did not throw us off our mission. Let's begin with an update on the virus in the county. Some of this you heard from the county executive. I'll try to expand on some of the things as I go through. Cases increased, as was mentioned, from early July through mid-August, but leveled off, and while they were slowly declining, have actually picked up on their decline as of the last couple of days. For 8 weeks in a row, we reported over 1,000 new cases. However, based on last week's data, we are on track to report well below 1,000 cases for the first time since late July. We'll have those numbers out soon. The county is among 22 jurisdictions in Maryland that the CDC reports as having high community transmission. However, our local data indicates we have decreased into the substantial range, so we've moved down a range in terms of transition, which is good, and the CDC will have us there this week, I believe. Last week, we dropped below 4% positivity, as you've heard, for the first time since the end of July. The average number of new cases in the county per day is now at 12 per 100,000 population. Still not where we want to be, but heading in the right direction. And while our cases are leveling off, the Delta variant remains the dominant strain spreading in Maryland. It is much more contagious, as you know, and can cause much more serious illness. Unvaccinated residents continue to make up the majority of cases, hospitalizations, and deaths. I can't say and stress enough, the pandemic has become a pandemic of the unvaccinated. If you haven't received the vaccine and you're eligible, you really should get vaccinated. Those who are going to the hospital sickest, those who are dying, are those who are unvaccinated in the vast majority of cases. Fortunately, our hospital capacity remains steady in the 50% range, so our hospitals are still in great position to help Prince Georgians get the care they need, whether it's for COVID or for something else. We continue to stress, again, the best way to stay out of the hospital or die from COVID is by getting vaccinated. Each vaccine available in the county provides strong protection against getting really sick from COVID, even the Delta variant. The vaccines are effective at preventing most infections. But like most vaccines, they're not 100% effective. So you're seeing breakthrough infections, and that's not a surprise to us, and it shouldn't be a surprise to you. Anyone who's been potentially exposed to COVID-19 or is experiencing flu-like symptoms should get tested, whether they are vaccinated or not, just to be sure. The science is showing even vaccinated people can spread the virus, although at much lower rates than unvaccinated folks. We need to do everything we can to avoid spreading the virus, especially among the unvaccinated folks who are now the folks who are most susceptible to serious illness and death. If you're not vaccinated, again, you are at much higher risk of getting infected and very sick from COVID. In fact, the CDC recently released new data showing that unvaccinated people are 5 times more likely to get infected with COVID than vaccinated people. 5 times more likely to get infected than vaccinated people. And unvaccinated people are 29 more times more likely to be hospitalized. 20 times more likely to be hospitalized from COVID than folks who are vaccinated. The vaccines are saving lives. The FDA would not approve these vaccines for us were they not safe or effective against COVID. The wait-and-see approach is over. The vaccines work. If you're not vaccinated, please get vaccinated. Every vaccination counts towards staying healthy and controlling this pandemic. And as I mentioned before, Prince Georgians have done a great job of getting vaccinated. Over 1 million vaccinations have been provided to Prince George's County residents. Now, 1 million that's a lot of shots in arms, given where we were at the beginning. When I first contemplated what we would need in the vaccine rollout, I knew it would be well over 1 million vaccines delivered to folks. And the idea of getting there was daunting. But again, under the county executive's strong leadership, the hard work of our Department of Health, our Incident Command, our Office of Emergency Management, we've gotten to over 1 million. And I want to congratulate them all for the hard work that they've been doing in the county and serving Prince George's. The CDC reports that 72% of county residents, I just want to make sure never want to get these wrong. The 72% of county residents 12 and older are fully vaccinated. That's 72% who are fully vaccinated of those who are currently eligible for vaccines. And over 85% of our residents 65 and older, again, are fully vaccinated, not partially vaccinated. Over 85% are fully vaccinated among our 65-year-olds. 65-year-olds and above. And we are very proud of those numbers. But frankly, we need more people to get vaccinated. The more people who are vaccinated, the harder it is for the virus to mutate. And when we say mutate, that means the virus changes its form and becomes a variant. And if we do that, it's harder for the virus to survive, it's hard for it to mutate, and it's harder for it to spread from person to person. So every shot in an arm gets us that much closer to getting COVID-19 completely under control. We also must prepare for a possible increase in cases as it gets colder this fall and winter, so it's especially important to get vaccinated now to stay safe and healthy. Now, as the county executive mentioned, third doses of the Pfizer and Moderna vaccine are available for Prince Georgians who have a weakened immune system. Generally, the FDA has authorized third doses for those who have conditions or take medications that suppress their immune system's ability to fight off infection. We encourage you to talk to your doctor before getting a third dose to make sure it is right for you. The FDA and CDC recently authorized booster shots for the general public. Those eligible to receive booster shots include individuals who are 65 and up, individuals who are 18 to 64 with an underlying medical condition that increases their risk for severe illness, and individuals who are ages 18 to 64 who reside in certain settings that increase their risk of exposure, as have been reviewed. That includes healthcare workers, school staff, grocery workers, and those in congregate living conditions. At this time, the CDC recommends booster shots only for people who initially received the Pfizer vaccine. Booster shots should be given at least 6 months after the second Pfizer dose. Booster shots for the general public for folks who have received Moderna or Johnson & Johnson have not yet been approved. Third doses and booster shots are available at doctors' offices and clinics across the county, at pharmacies, urgent care centers, and grocery stores. They're also available at our mobile clinics and at our stationary clinic at the Sports and Learning Complex 7 days a week. You do not have to go back to the same clinic where you received your earlier doses to get your booster dose. And you do not have to show proof of eligibility to receive your third dose or booster shot. Just remember when you got your second doses of the vaccines. Excuse me. Now, I think it's important that I take a moment. I think where some confusion resides for folks is the difference between a third dose and a booster shot. Third doses are being recommended of Moderna or the Pfizer vaccine for those folks who are immunocompromised or taking medicines that might make them immunocompromised. So someone who may have had an organ transplant, someone who may have also had some other kind of immunocompromising condition. The reason is when those folks received their first 2 shots of the Moderna or the Pfizer vaccine, they may have mounted a response that took them to a certain level, this level. The normal level for folks who aren't immunocompromised likely would be up here. So it's a higher and a stronger immune response. When you get that third dose, it's hoped that that third dose takes you up to the level of folks who received those first 2 shots. And so for those folks who may have had 2 shots of Moderna or Pfizer, who have an immunocompromising condition, who may not have mounted a high enough immune response, that's why they're recommending a third dose 28 days, at least 28 days after that second dose was received of Pfizer or Moderna. With respect to the booster shot is given because folks who received the first 2 doses of Pfizer may have had a great immune response, but they may have also had what's called waning immunity. So those first 2 shots took you up here. Over time, they're saying 6 months or so, it may have come down to here. What this booster dose does is boost that immune response again, and it'll take you back up to here or maybe even higher. Again, it's because the booster dose is to boost the immunity that may be waning, and the third dose is to make sure that the folks who are immunocompromised have the adequate initial response to being vaccinated. So I hope that helps explain some of it. I sympathize with all of you who hear different explanations. Even the folks who we rely on for our scientific information going back and forth. But we'll continue to do our best to get the best information out to you in either graphic form or on our website to make sure we keep you up to date with what's what. Our determination to get more people vaccinated and healthy has not slowed down and won't. And now is a critical time to keep momentum going as our students have officially returned to the classroom for the first time since the onset of this pandemic. I'm really excited about that and really excited about the job that our Prince George's County Public School System has done in getting our kids in school and keeping them in school. The county has had success in partnering with the Prince George's County Public Schools to vaccinate students ages 12 and up and other eligible family members through our mobile vaccine clinics at middle schools and high schools this summer and early fall. And we anticipate that the FDA will authorize use of COVID vaccine in children 5 to 11 within the coming days or weeks. We assure you that our health department will again work closely with our public school system to ensure our children and families have access to the vaccine. We encourage parents with children in this age group to speak to your child's health provider if you have questions or concerns about the vaccine, and to be prepared to get your child vaccinated when we are given the green light by the federal government. As we remain vigilant in our fight against COVID-19, we must also remember that we are now in flu season. Getting your flu shot is the best way to protect you from getting very sick or dying from the flu. Some people, such as older folks, young children, people with certain health conditions such as heart disease, asthma, or sickle cell disease, are at high risk of serious flu complications. Those who skip the flu shot are more vulnerable to serious illness and death, and more likely to spread the virus to others around us. The health department encourages those with health insurance to get their flu shots through their primary care provider, a local retail pharmacy, or an urgent care facility. Residents are also encouraged to visit one of several flu clinics being held throughout the county. For more information about flu vaccine and how to receive a flu shot, we encourage you to visit the website health.mypgc.us/flu. Again, for flu shot information, health.mypgc.us/flu. Now, getting our children vaccinated against flu and COVID-19 is especially important as we enter I think, a fun holiday season. While we continue to navigate this pandemic, we want to take a moment to remind you of the importance of staying healthy, staying safe and healthy, even as we approach these fun holidays. For Halloween, our health department recommends following masking and social distancing requirements while door-to-door trick-or-treating this year. We must stress that anyone showing symptoms of COVID-19 or who has recently been exposed to the virus should not participate in in-person Halloween festivities and should not be giving out candy at their doors. We also recommend practicing additional Halloween COVID safety tips. If you choose to trick-or-treat door-to-door, only do so with members of your household. Consider Halloween-themed face coverings instead of costume masks. Costume masks have mouth and nose openings, and when worn alone, do not provide the same protection as cloth face coverings. Also, keep in mind that the costume mask on top of a cloth mask can be dangerous and limit breathing. So we suggest that you wear costume-themed cloth masks instead of costume masks, and certainly not both at the same time. Do not share masks. Do not share things like costume fangs or other similar items. Bring an alcohol-based hand sanitizer with you during trick-or-treating and use it often. Avoid touching your eyes and nose and mouth, as germs can easily spread that way. Candy should be given out using a scoop or tongs so the candy is not directly handled, and children should not reach into candy bowls or bags. Instead, we recommend providing individually wrapped goodie bags or put on a table at the edge of your driveway or your yard. If you are preparing and handing out treats, be sure you are following proper hand hygiene. When returning home with treats, be sure that children wash their hands properly with soap and water before eating anything. And avoid party games like bobbing for apples or other activities that might involve sharing items that come into contact with other people's mouths or noses. In conclusion, I just want to say the science and the message are clear. We have the power to keep each other healthy and alive. I know Prince Georgians care deeply for each other, and I can't think of anything more caring right now than to get vaccinated. Vaccines are free. You don't need insurance. We don't care about your immigration status. We don't care who you are. We only care about your health. Getting very sick from COVID is preventable. Getting sick from COVID, getting very sick from COVID is preventable. It's heartbreaking to know that only a few needle sticks and arms could have saved so many people. Whether it's a booster shot or a first shot, vaccination remains our best tool to protect ourselves and each other from COVID-19. Thanks to the vaccines, getting sick from COVID again is preventable, and ending the pandemic is achievable. We have the weapons, and we have the willpower, and we have, I think, the leadership to make it happen. Thank you.
So thank you, everyone. With that, we'll open it up to questions. I think I saw Brad's hand first, and then we'll go to Will, and then we'll come over to the side of the room.
Just a couple of questions. 64% of the county employees, that's lower than the general population. Who's not getting vaccinated? Is it police and fire, or is it heard elsewhere?
So I'll answer that in two ways. We are still compiling information. What we've done is to request information from our employees regarding their vaccination status, and what we know so far is that 64% have been vaccinated. We expect, hopefully, for those numbers to increase as we get more responses from our employees. But we do know, similar to what we're seeing nationally, that we're seeing lower numbers of vaccination among our public safety employees. And so we'll be working to encourage additional vaccinations there, and to incentivize vaccines. So but we do see that the numbers, which are consistent with what we're seeing nationally, that they are lower, and we have some concern regarding just the need to work with some of our public safety employees in the vaccinations.
At this point, how can you win the vote? I mean, you're so far into it.
You know what? I think that's a question that's being answered across the country, and it'll be our approach to do what we can to work with them, to provide whatever information is needed, whatever education is needed, and to provide the opportunity to be tested for those who opt not to be vaccinated, and we'll be working with them. They are essential to what we do, and we'll be working hand in hand with them to make sure that they are safe and that our residents are safe.
And when the numbers decline or flat or wherever they are, infection rate or what, why the kids now? Why the expansion of kids? I tweeted and it's already getting some reaction. Negative.
Right. So what we're seeing is that of course some of our kids are getting sick. We're concerned about that, and we just want to do what we can to protect more and more of them, which is why we've expanded the mask mandate now to also include 2 to 5-year-olds. We know that masking works. That's the bottom line, is that wearing the mask actually does work in terms of stopping the transmission of COVID-19. And the assumption is not, it is not an accurate assumption to assume that kids can't get sick. Some of them are getting very sick. And we believe that it is avoidable if we can wear the mask and keep more of them safe.
So we'll go to Will, and then we'll go to the other side.
Dr. Askew, a couple questions. please. One, do you have any updated data in terms of teenagers who have been vaccinated between the ages of 12 and 17? And also, I got to read the notes here to make sure I get this. The second part, the Institute for Health Metrics and Evaluation at the University of Washington did a forecast that Maryland could see 6,000 plus cases by November 26th. Just for Prince George's, are you spreading the word of any, or making sure to ease people concerned that hospitals could see an influx of patients based off just this forecast, and also, Frank touched on a few people still not vaccinated?
Sure. Well, let me start with your first question. The data for our 12 to, what we're seeing for our 12 to 19-year-old folks who are being vaccinated is that it is now past our 20 to 29-year-olds who've been vaccinated. So it's our 20 to 29-year-old group of folks that we're actually a little bit more concerned about, because they're the trailing group right now. The 12 to 19-year-olds have surpassed that group. They're catching up to our 30 to 39-year-olds and our 40 to 49-year-olds, who are sort of our leading groups. Our seniors are clearly far and ahead of everyone else. But we're happy with where our 12 to 19-year-olds are headed. As I said, already have passed our 20 to 29-year-olds. With respect to forecasts, that's the exact reason we want to make sure we don't let up. Even though our numbers are starting to take a dip, we anticipated that they would start to take a dip and may even take a big nosedive down. The lower we get now and the more folks we continue to get vaccinated, the less likely it is that we see a significant surge in that November time period where we start to go into Thanksgiving, and then we go into Kwanzaa and Christmas and New Year's and Hanukkah and traditional gathering holidays for folks. So again, the lower we get those numbers now, the less concerned we'll have to be with those numbers popping up during the latter parts, the earlier parts and latter parts of the winter.
John, can I get a follow-up with the age group real quickly? Thank you. Have you been able to see, sir, why the 20 to 29-year-olds are still the group you're trying to work with still?
I think it's, I can't get into the head of a 20 to 29-year-old. That was many years ago for me. But what I can say is, traditionally with any kind of public health work done with that age group is there, for the most part, very healthy people. And consider themselves very healthy people. Many years ago when I worked on healthcare reform and trying to get folks to get health insurance, younger people didn't feel necessarily that they were vulnerable to the conditions that led to issues where you would need to be insured. But I can assure them of this: they are vulnerable to COVID. They will catch COVID if they don't get vaccinated, and some of them may risk going to the hospital, being admitted to the hospital, and some of them may be even risking death by not getting vaccinated. They're young and healthy, but COVID is something else.
Go ahead.
I wanted to talk a little bit about the rising COVID numbers inside PPCPS classrooms. The cases have been growing since the first day of school. Are you concerned about that, and how are you working with the school system to enforce their health protocols?
Sure. No, the school system has been extraordinarily collaborative in reaching out to us for guidance. We most recently helped them revise their quarantine guidance to make it so that we keep kids in school as much as possible. Again, a lot of children are still unvaccinated, so we expect to see cases in classroom. We expect to see folks who have to be quarantined because they were close contacts of cases. What we're not seeing is something that's out of control. What we're not seeing is something that's leading us to closing down full schools. So for the time being, I'm happy with the way the schools have been handling the situation. In particular, they were out front with making masking a mandate within schools, far ahead of many folks in many other locations. They were far ahead of other folks when they said, we are going to mandate that our staff and our employees be vaccinated. And so, again, I'm really happy with them taking the steps forward to prevent some of the things we're seeing in other parts of the country, even other parts of the state where you're seeing just sort of massive numbers of students who are out of school.
I know we had, yep, right there.
Two questions for Dr. Askew. Just to touch on the mask for 2 to 5-year-olds again. You guys, telling us that the county is trending in the right direction. Numbers are starting to level off, and the decline is actually, speeding up. Yet here you are saying 2 to 5-year-olds need a mask. Some folks might see those things in conflict with each other. What is the data showing you, or are there any numbers you can give us in terms of maybe how kids are being impacted that shows, hey, this is why we need to do this, even though our numbers are trending in the
Sure,
right direction?
and I think one of the things we have to keep in mind is that we have, from the beginning, did our best to stick to the science, stick with the CDC recommendations, and we. When given the opportunity the first time, we made our cutoff at 5 years. Not knowing when vaccines would become available for younger kids, not knowing what the data might show with respect to what happens when children return to childcare. Now we know that soon vaccines are going to be available for that younger age group, those kids 5 to 11. Those kids below 5 will still not be eligible for vaccines. So they will be our last group of folks who are not eligible for vaccine or who are not getting vaccine. We need to make sure we protect those children. And there are parents, just as you may be, as Brad mentioned, he's getting, folks who are responding that they may be upset by that. We get, I think, just as many, if not more, from parents who say, I can't believe we're not masking 3-year-olds or 2-year-olds in the child care center, and folks who are, frankly, who had pulled their kids out of child care settings for fear that their child would get sick, because they know this is the group of folks, when push comes to shove, in the end, they're going to be the last ones to get vaccinated, and we have to do our best to keep them safe.
And then in terms of the booster third dose, any concerns about an equitable distribution of those boosters and third doses? We saw what happened when the initial vaccines rolled out, the steps you all had to take to make sure the most vulnerable were getting their shot in their arm. Do you expect to have to use those types of measures again, or is this going to be a different kind of scenario?
No, we have our eyes on the prize when it comes to social justice and social equity with respect to vaccine distribution, particularly now, from our previous experience now with the booster. I don't anticipate any issues. I would welcome you to alert us of any conditions, concerns that you might have, so that we can address it immediately. But again, I don't anticipate any equity issues.
Back to schools, do you have, I've asked the schools, they send it to you guys have asked, do you have any numbers on positive tests out of the county school system, and how many have been quarantined or currently are quarantined? Do you hear numbers elsewhere? Haven't heard numbers.
Yeah, I don't have those numbers on me right now, Brad, but I'll try to dig those up to you and get someone to forward them to you. Actually, make sure that they're made available, or at least talk to the schools about their ability to make those available.
Just on Corey's question, I'm wondering more about the masking for 2 to 5-year-olds. Is there any the timing of this have anything to do with the weather? I mean, last time we were coming into the fall, people were worried about getting back into congregate settings, being inside. Is that too simplistic? Does that
No, we consider many factors, and that's certainly, again, one of the factors that we consider going into winter. More likelihood that folks are going to be in enclosed spaces, spending a lot more time together. And again, these are going to be kids ultimately who are not going to be eligible for vaccine right away.
2 questions for the executive, if you don't mind. Off of Brad's question, do we have any numbers for how many public safety employees are not vaccinated, or any data that we can use to look to?
So I can get you the exact numbers. It looks like it's a substantial number, is what we have so far, is that there are, I'll have to get you the exact numbers, but it looks like there are a substantial number who are unvaccinated. And, we, to be honest with you, I think we probably were a little surprised. I thought they would be high, but maybe not as high as they are. They're pretty high.
I was going to ask, does that concern you, being that these are the people who are, on the front lines here?
It does. You know what? We're concerned both for them and we're concerned for our residents, and that's why we're going to have to balance the response to it. is to continue to make those vaccines available, to urge that people become vaccinated, to do what we can to test those who opt not to be vaccinated, so that they will know their status and so that we will continue to know their status, and to do all that we can also to incentivize where possible the vaccinations. And so we're concerned for them and for their families, because they go home to loved ones and young children, and they are interfacing with our residents. And so we're going to do everything we can to make sure that everyone is as safe as possible.
Just really quickly on rental assistance, you said that Prince George's County is doing better than the rest of the state. Can you say why, very specifically, why the money is coming out of Prince George's and not other places, and how much have you been able to give out?
So we've given out over $30 million so far. I think it's about $30.8 million. We're getting it out the door really quickly, and if I just might say something that seems immodest, they're just good. Our Department of Housing has just done a phenomenal job. We're very proud of them. And proud of the work that the entire team has done. They've worked really hard. And you know what? We also want to credit our partners. We've been working with many in the faith community and working with other community partners who are assisting us. We're going to be working with Casa de Maryland. We're working with a number of community partners who have been committed. We've worked in Suitland, for example, recently. Community leaders there have stepped up to help us actually get individuals signed up for it, to help them fill out the applications. So everyone's committed throughout. And so far, it's really helping us. Now, that isn't to say that we still don't have a lot of work to do, because, to be honest with you, there's a lot of frustration. The tenants are frustrated, the landlords are frustrated, and that's why we're just encouraging everyone. Let's please just work together as best we can to make sure this happens as quickly as possible. Winter is coming. And we want this issue to be addressed and for people to be secure in their housing. So we still have a lot of work to do. You know, being first in this doesn't mean that we still are not concerned about getting it out quickly. Thank you.
And then, Will, I know you're going to follow up on rental assistance.
Rental assistance for, excuse me, for next Saturday, Land Park. You haven't anticipate how many people show up and who will be there to help some of these residents?
In Langley Park.
Yes.
So, you know, I think if Suitland is any indication, and we had 400 plus who were there, we expect that Langley Park will also be very well attended, and we'll be ready for them. We have our Office of Community Relations working with us, and again, other partners who are helping us to serve our residents. We expect it to be a robust crowd, and we'll be ready to get people information and to get them to help them apply there on the spot.
Okay, thank you, everybody.
Thank you.
Unrelated.
Last question.
Is it good? County Executive Alsobrooks, our colleagues at Telemundo were wondering if you could respond to some of the criticism that's come out recently from some of the county's Latino and Hispanic leaders about what they consider your failure to hire a single person of Hispanic descent to an agency-level position since you were elected. Your response to those critics?
Well, that part of it's not true. So we actually did hire. I mean, some of them, we had, wonderful, some of the people that we have hired have since left. One took a job in another jurisdiction at higher pay, one of the directors that we hired, and we have hired others who have accepted employment in other places. You know what, we agree that it is a priority to make sure that our government is diverse, to make sure that all of the that the government's services, that we're making sure that we are available and accessible to every aspect of our community. We regard it as a priority as well. We've worked to make sure we attract people to our government of Latino descent. We'll continue to do that because we think it's valuable to have a government that represents every aspect of our community. So I share the concern. We've been working with CASA. We've worked with some of our electeds and others to ask them to help us identify individuals who are interested in opportunities in the government so that we can interview those individuals. And we would love to have a government that is diverse as possible. We won't give up on that goal, but they're right to point out that, you know what, it's still a challenge for us, and we still have work to do there, and we will continue working until we're able to be as diverse as possible in the government.
Our colleague Telemundo are asking specifically about, I guess, your executive.
Yeah. Mm-hmm. No. So we, again, it is the case that it is not true. First of all, that we've not had anyone on the executive staff. Let's clear that part up. That is not true. We have hired, and some of those individuals have left. It is true that we have more work to do, and that it is not necessarily easy for us always to be able to get the numbers that we would like in. And we just met just last month with Casa de Maryland and said, you know what, we'll continue to work with you. Please give us recommendations and we've been working all along to try to get recommendations so that we can identify individuals as we have vacancies come available. We'll continue to do that because we agree that this is something that's valuable to the government and valuable to our community. The representation matters. We agree.
Thank you, everybody.
Thank you.